Zoledronic Acid Vial is a medication that is used to treat high blood calcium levels that can happen with cancer. It is also used with cancer chemotherapy to treat bone problems that can occur with multiple myeloma and other types of cancer that have spread to the bones. This medication belongs to a class of drugs called bisphosphonates. It works by reducing the amount of calcium released from your bones into your blood, and also by slowing the breakdown of your bones by cancer to prevent bone fractures. It is important to take this medication as directed by your doctor for the best results. Before you start receiving zoledronic acid, make sure to read the patient information leaflet provided by your pharmacist. This medication is given by injection into a vein as directed by your doctor, usually over at least 15 minutes. The dosage is based on your medical condition and response to treatment. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. Avoid mixing zoledronic acid with 4 fluids that have calcium in them. For the treatment of high blood calcium levels, fluids are usually given through a vein before you receive this medication. To decrease the chance of kidney problems, drink plenty of fluids during treatment unless otherwise directed by your doctor. It takes at least 7 days after a dose to get the full benefit of this drug. The dose may need to be repeated depending on your blood calcium levels. For the treatment of multiple myeloma and bone problems caused by the spread of cancer, this medication is given as directed by your doctor, usually every 3 to 4 weeks. You may also be instructed to take calcium and vitamin D supplements each day. Some common side effects of zoledronic acid vial include dizziness, headache, tiredness, or flu-like symptoms such as fever, chills, muscle/joint aches. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any severe side effects, such as increased or severe bone/joint/muscle pain, new or unusual hip/thigh/groin pain, jaw/ear pain, eye/vision problems, numbness/tingling, muscle spasms, or irregular heartbeat. Additionally, seek medical help right away if you notice any signs of kidney problems or experience seizures. While a severe allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using zoledronic acid, make sure to inform your doctor about any allergies you have, especially to other bisphosphonates. This medication could contain inactive ingredients that may cause allergic reactions. Also, discuss your medical history with your doctor, especially if you have kidney problems or dehydration, or if you have aspirin-sensitive asthma. Some people using zoledronic acid may experience serious jawbone problems. Your doctor should check your mouth before starting this medication, and it's important to inform your dentist about using this medication before any dental work. Regular dental exams are necessary to prevent jawbone problems, and if you experience jaw pain, notify your doctor and dentist immediately. If you have any upcoming surgery, especially dental procedures, inform your doctor and dentist about using this medication and any other products you're using, including prescription and non-prescription drugs, and herbal products. Zoledronic acid may cause dizziness, and the use of alcohol or marijuana can worsen this effect. It's important to avoid driving or using machinery until you can do so safely, and limit alcoholic beverages. If you're using marijuana, discuss this with your doctor. Older adults may be at a higher risk of developing kidney problems while using this drug. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as zoledronic acid may stay in your body for many years and can harm an unborn baby. Reliable forms of birth control should be discussed with your doctor while using this medication and after the last dose. If you become pregnant, talk to your doctor immediately about the risks and benefits of this medication. It's unclear whether this drug passes into breast milk, so breastfeeding is not recommended while using this medication and after stopping treatment. It's important to consult your doctor before breastfeeding. When taking Zoledronic Acid Vial, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's important to note that there is another zoledronic acid product used to prevent or treat bone loss, osteoporosis, and this product should not be used together with the zoledronic acid vial. This is crucial to avoid any potential complications or adverse effects. Always consult with your healthcare provider for the best timing and appropriate daily dosage for taking zoledronic acid vial. If someone has taken too much zoledronic acid vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of overdose may include changes in urine output, muscle spasms, weakness, changes in mental/mood, irregular heartbeat, and seizures. It's crucial to get help right away in cases of overdose. Before starting zoledronic acid vial, your doctor will conduct lab and/or medical tests to check your calcium and other blood mineral levels, as well as your kidney function. It's important to attend all medical and lab appointments while using this medication. Make sure to consult your doctor for more details. When using zoledronic acid vial, it is crucial to take each dose as prescribed. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. It is important not to take a double dose to make up for a missed one. Be sure to check the product instructions and discuss with your pharmacist about the proper way to store this medication. Always keep medications out of reach of children and pets. Avoid disposing of medications down the toilet or drain unless instructed to do so. When the medication is expired or no longer needed, be sure to properly dispose of it. You can consult with your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.